Hi everyone, welcome back to my channel. In last video we talked about the overview of Norma Basalis. In this video we will talk about the foramens that are present in Norma Basalis. We will start our topic with introduction. Norma Basalis is the inferior view of skull that contains several foramina that are basically the opening that serve as essential passageway for nerves, blood vessels and other structures. These foramina play a vital role in neurology, anatomy and surgical procedures. Now let's talk about the foramina of the Norma Basalis. Foramina allow the passage of the cranial nerves, arteries and veins. Their location and functions are crucial for brain communication, circulation and motor control. Understanding them aids in neurosurgery, trauma analysis and anatomical studies. Major foramina of Norma Basalis include foramen magnum, carotid canal, jugular foramen, hypoglossal canal, foramen ovale, foramen rotundum, foramen spinosum, stylomastoid foramen, and internal acoustic meatus. The first foramen is foramen magnum. There, its location is in occipital bone and its function is it allows the spinal cord to pass and connect to the brainstem. Structure passing through foramen magnum are medulla oblongata, vertebral arteries and accessory nerve, that is ninth nerve, cranial nerve. The next foramina is carotid canal. Its location is in temporal bone. Function is it transmits the internal carotid arteries supplying blood to the brain. Structure passing through carotid canal are internal carotid artery and sympathetic nerve fibers. The next foramen is jugular foramen that is located between the temporal and occipital bone. Its function is it allows the passage for veins and cranial nerves related to blood circulation and motor function. Structure passing through are internal jugular vein, glossopharyngeal nerve, vagus nerve and accessory nerve. The next foramina is hypoglossal canal. Location occipital bone near the foramen magnum. Function it transmits the hypoglossal nerve controlling tongue movement. Structure passing through hypoglossal canal are hypoglossal nerve, that is cranial nerve number 7. Next foramina is foramen ovale. Location sphenoid bone. Function it allows passage for a major division of trigeminal nerve aiding facial sensation. Structure passing through foramen ovale are mandibular branch of trigeminal nerve. Next foramen is foramen rotundum. Location is sphenoid bone. Function is to transmit sensory fibers from the midface to the brain. Structure passing through foramen rotundum include maxillary branch of trigeminal nerve. Next is foramen spinosum. Location is sphenoid bone. Function is it allows passage for arteries supplying the meninges. Structure passing through foramen spinosum includes medial meningeal artery and meningeal branch of mandibular nerve. Next foramen is stylomastoid foramen. Location is temporal bone near the stylomastoid process. Its function is it transmits facial nerve controlling facial expression, and structure passing through stylomastoid foramen is facial nerve. That is really important nerve. The next foramina is internal acoustic meatus. The location is temporal bone and it transmits nerve fiber responsible for hearing and balance. Structure passing through internal acoustic meatus include vestibulocochlear nerve and facial nerve. Now let's talk about the clinical and surgical importance of knowing the foramina of the Norma Basalis. Neurosurgical disorder, as a damage to cranial nerve passing through the foramina can lead to sensory or motor impairment. So to understand the neurological disorders, it is important to understand the foramina of the Norma Basalis. The next is to assess the trauma or in trauma assessment, as skull-based fracture affecting foramina can disrupt vital function. The next significance is in surgical planning, as understanding foraminal location is crucial in procedures like tumor removal, vascular surgeries, and nerve repair. So this was all about the foramina of Norma Basalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.